Hello friends, I am Dr. Shruthi Purushotham. I am a consultant pediatrician and neonatologist at Apollo BG's Hospitals, Mysore. Today I am going to talk on a common childhood condition called febrile seizures. Febrile seizures are seizures that is seen in children between the age of 6 months to 5 years with a temperature of 38 degrees Celsius or more, which is not as a result of central nervous system infection or any metabolic imbalance in a neurologically normal child. It is seen in 2 to 5% of children less than 5 years of age. The cause of febrile seizures is not known. However, genetic predisposition is often observed. The risk of developing febrile seizure is common in a child when there is history of febrile seizure in a sibling or a parent during their childhood. Febrile seizures can be classified broadly as simple febrile seizures and complex febrile seizures. Simple febrile seizure is a seizure with its onset within 24 hours of onset of fever. Usually it is a single episode lasting for less than 15 minutes and is usually generalized tonic-clonic convulsions. Whereas a complex or atypical febrile seizures, usually the onset is beyond 24 hours of onset of fever, can be multiple in nature, can be focal, that is, it can involve a single limb, and also it can happen in a developmentally delayed child. So what to do when my child has a febrile seizure? When your child has a seizure, you should stay with your child. Make the child lie down on a flat surface, preferably on the floor. Turn the head to one side so that the secretions are cooled and it will not get aspirated. Do not put anything into your child's mouth. So what are the indications of admission for a child with febrile seizures? Not all children having febrile seizures require admission. If the age of onset is less than 1 year, there are multiple episodes of seizures. The seizures are focal or complex in nature, and it is the first episode of seizure or the doctor or the pediatrician is suspecting a brain infection. Only then the child needs to be admitted and evaluated. So what is the treatment of febrile seizures? So when a child has febrile seizure, or not all children require treatment. Antipyretics like paracetamol can be given to reduce the temperature to make the child comfortable, but paracetamol will not prevent the recurrence of febrile seizures. As I've already mentioned, not all children with febrile seizures require any kind of anti-epileptic treatment. But in some children who have recurrent febrile seizures, something called as intermittent prophylaxis can be given. To conclude, febrile seizure is a frequent and a benign disorder seen in infancy and early childhood. Parental education, reassurance and anti-epileptic treatment constitutes the main modality of treatment. Thank you.